Welcome back to another edition of the Well and Good podcast. My name's Jay Smack, your host and producer. The Well and Good podcast explores topics aligning with, well, wellness and goodness. The pause there is because the wellness is health, nutrition, mindfulness, things of that nature. And then the goodness is mostly nonprofits, charities, putting positive things back out into the world. And if not necessarily quote unquote positive, something from which hopefully you and I can learn. I'm coming at this from a point of curiosity and engagement in one's own wellness and health. So join me for these interesting conversations. I talk to people way smarter than me and get their opinions and their expertise on subjects that are valuable, useful, hopefully to you and your wellness and hopefully goodness. On this edition, I have Mindy Conklin, founder and Executive Director of HCB2. That's Hitting Cancer Below the Belt, a colorectal cancer awareness group. Also, Dr. Andrew Vorenberg, colorectal surgeon with Colon and Rectal Specialists and board member of HCB2, and Kristi Seay, Endoscopy Nurse Manager with VCU Health and current chair of HCB2. So here we go. Please enjoy the conversation and hopefully you'll take something useful away from it. I must mention March. This episode is airing on March 5th, is Colorectal Cancer Awareness Month. So do your part, be aware, have the conversation, and you'll be much better off for it. Here's our conversation now on the Well and Good podcast. Well, here we are on another edition of the Well and Good podcast. My name's Jay Smack. I'm here with Mindy Conklin, founder and executive director of Hitting Cancer Below the Belt, HCB2. Also founding board members, Dr. Andrew Vorenberg and Kristi Seay. And why don't we go around the table a little bit and just give who you are, your title, and what brought you to this organization. Mindy, let's start with you.
Yeah, hi, yeah. Mindy Conklin, founding a member and the executive director of Hitting Cancer Below the Belt. The organization began in 2013. Unfortunately, it began because my husband passed away of colorectal cancer at the young age of 43. We were married for 20 years and raised two beautiful children together, and it was devastating. His diagnosis was devastating at age 41, and then unfortunately he did pass about 18 months later. So that was in 2011. Wanted to take some time and kind of figure out my next move. Wasn't sure if I was going to stay with my current job, stay with my current job, or move into a different direction. And then I realized over time that we needed to do something about colorectal cancer here in the Richmond community because nobody was really talking about this disease. And this disease is the second cancer killer in our country in men and women. It's right behind lung cancer. So I ran across Dr. Vorenberg really early on when developing the organization, and I'll let him tell the story next.
Hi, so I'm Andy Vorenberg. I'm a colon and rectal surgeon here in Richmond, and I came into this because I'm from Richmond, Virginia. I grew up here. Family is still here, very much involved in the community. And when I moved back to Richmond, I started in a private practice and realized that there's nobody talking about colorectal cancer in Richmond or really in the state of Virginia. There were no organizations that specifically target awareness, and there are no events that specifically target awareness for colorectal cancer. So 2012 is when I started looking into starting a colon cancer race. And so I called the Richmond Roadrunners and I said, hey, I'm interested in starting this. Can you show me, is anybody doing this? Because I don't want to overlap with anybody. I don't want to fight anybody over this. So let's collaborate. And they said, actually, this lady named Mindy Conklin is looking at doing that for the first time this year as well. And I said, well, let me give me your numbers so we can see if we can join forces. And that's how Mindy and I met.
That's a hell of a coincidence.
Right.
You had contacted them the same year about the same thing?
I had contacted Bill Kelly from Richmond Roadrunners and was moving forward and he was helping me create this event. And he said, "You need to give this guy Andy a phone call." And I was so, deep into planning, I didn't call him immediately. Probably 2 weeks later, I didn't know that Andy was Dr. Andrew Vorenberg. So I would have called him back much quicker if I had known that, but I didn't know that at the time.
Yeah. What a coincidence. And we both were working on the same project, and we joined forces, and here we are, 7 years later.
Are you both runners? Is that why you reached out to the running community?
Right. So I'm a runner as well. I grew up, I did cross country and track in high school and just ran things and events and ran a race up in D.C. And I said, why aren't we doing this in Richmond?
Right. It makes perfect sense. And I'm a cyclist, and the first thing I would do is reach out to the cycling community. You'd go with who you know.
Right.
How about you, Kristi?
Well, I'm Kristi Seay, and I'm a registered nurse. I've been in the field of endoscopy since 1990. I am not a runner, but I had the pleasure of working with Dr. Vorenberg, and he just happened to mention to me about planning this 5K, and I said, this is my passion. This is what I do as my profession, and I would absolutely love to be a part of that. And so I met everyone at a restaurant at my first meeting. Dr. Vorenberg wasn't there yet, and I did not know a soul, and I walked in and joined this lovely group, and have been a part of it ever since.
Wow, that's really cool. Well, I appreciate everybody coming in, and especially spreading the word. I think I guess I'm the layman in the room, people don't talk about colorectal cancer because it seems embarrassing because of the nature of it, but it's so preventable from what I understand. Sort of like Mindy and I were talking before we opened the mics about addiction, how people don't like to talk about addiction. Maybe it hits a little bit too close to home. Maybe it's a little bit too personal. But what are some of the misconceptions about colorectal cancer? And then we'll get into how people can prevent and screening and things of that nature. Dr. Vorenberg, if you wouldn't mind, maybe start about some of the misconceptions about colorectal cancer.
Well, there are lots of misconceptions about colorectal cancer that get perpetrated because I think people, just like you said, don't want to talk about it. Some people think it's only a male problem or only a female problem. Some people are worried about the prep. Some people are worried about the anesthesia and the procedure itself. And then some people know somebody who knew somebody who got perforated during a colonoscopy, and they're worried about that, which is a very uncommon problem to have with that procedure. So there are lots of reasons why people don't want to have a colonoscopy, and that's why a third of the American population who should be getting screened are not being screened. And like you said on the intro, it's one of the most preventable cancers. If you go in and think about it like tending your garden and weeds, if you go in and grab the weeds out before they overgrow your garden, you'll have a nice, beautiful garden. If you go into the colon and look and find polyps, then you can take those precancerous growths out before they turn into cancer. And so we are talking about prevention of colorectal cancer. That is the name of the game, not identification of colon cancer early, although that's good, but prevention is really the key at this point.
Can you explain exactly what a polyp is versus, say, a tumor in another part of the body that might start as a small growth? What exactly is a polyp, and why is that not cancer?
Great question. So the way that we think about colon cancer, it starts with a mutation in one of the cells in the lining of your colon wall, okay? And then that mutation causes the cell to continue to grow when it shouldn't be growing. And so what that does is it causes the cells to duplicate and multiply and forms a growth that grows into the middle of the colon, into where the stool goes through the middle of the colon. And as long as it doesn't invade the colon wall, then it's not cancer. It's precancerous at that point. But a couple of mutations later, and as time goes by, those cells that have already mutated, they mutate again, and they develop the engineering to dive into the colon wall. And then that is a cancer, because once a cell goes somewhere it's not supposed to be, it can then spread and live on its own in a different organ, in a different body space, that it's not supposed to be. And then it's hard to kill that cell at that point.
How long does it take for a polyp to become a cancerous growth? I mentioned my grandmother passed from colon cancer. I've been screened, so they put me on the 5-year plan. Even that seems too long. I'm like, shouldn't I be coming in every week?
Yeah, great. That's a great question. I mean, we don't know how quickly each individual's polyps or tumors grow. Okay, so there's guidelines out there which are ballparks of when we should be screened, because we don't know exactly what your biology is going to do. So we screen you more frequently if you have more polyps. If you have larger polyps, you get screened more frequently. If you have a family history of colon cancer, you get screened more frequently. If you have any other inflammatory disease in the intestines, you get screened more frequently because we think that polyps will grow faster in you. But it's a ballpark. And so that's one of the more unnerving things about colorectal cancer, is that you don't know how or when a polyp is going to grow. That's why screening is so important, and listening to your body and the signs and symptoms that your body gives you, which could be and typically are very subtle, until you have significant rectal bleeding or constipation or change in your bowel habits, which mean that the tumor is getting very large at that point. So they're late symptoms.
Isn't it true that sometimes none of that stuff occurs? And Mindy, I saw from the material on the website that your husband felt a stitch in his side, right? But none of the other stuff had happened. Is that right?
That's correct. Yeah, he was diagnosed at stage 4 colorectal cancer, and but what brought him to the doctor is that he had a stitch in his side that he couldn't seem to stretch out. It turned out those were 9 tumors on his liver. So as Dr. Vorenberg had stated, these rogue cells can break off, obviously, and metastasize to another organ. And my husband had the liver that was attacked, which is quite common, I understand, in colorectal cancer. And that's one thing that we talk about quite a bit when we go out and do public events, corporate or community events, is folks say, well, I don't have any symptoms. I think I'm good. I'm not going to be screened at age 50. Just because you don't have any symptoms doesn't mean you don't have any polyps. And not all polyps bleed, so you may not even have blood in your stool. It's just really important to have a scope that can look at the colon and really check out. That's what Dr. Vorenberg is doing, is he's actually looking and then removing anything that should not be in there, such as a polyp. So you're absolutely right. My husband did not have a family history. He's the baby out of 7. All of his older brothers and sisters are totally fine. His mom and dad are fine. He did not have symptoms that he told me about. And what brought him to the doctor was a stitch in his side. So it's critically important to begin screening at age 50. And African Americans at age 45, they're at a higher risk. Even if you have no symptoms, that's when your life is saved. Your life is a little bit more difficult to save at stage 4. Stage 1, I believe it's 90% of a success rate, of a survival rate, if caught at stage 1. And most of the time, stage 1, it does not. You don't have symptoms. It's very common.
And you mentioned that he didn't have symptoms, at least that he told you about.
That he told me
That's
about.
probably pretty common for men to feel something or have something going on and not mention it, try to tough it out, or think that it'll go away.
And that's one reason why we're here, is to break the silence. We say potty time is no longer private time. And there's a campaign we have called Can We Talk, which is 6 simple questions that you can ask yourself and then take back to your loved ones, just to break the silence and raise the level of conversation about this disease.
Kristi, as an endoscopy nurse with VCU Health, are you on the front lines of the testing? Are you still on the front lines, or just I want to get into the process of the testing, because, as I said, having been tested, it was super easy and there's nothing to be afraid of. I actually, this will sound weird and I'll explain why. I enjoyed it because you go in, they put you under. But I'm fascinated by the body processes. And everybody thinks, well, I won't go under immediately. I was under immediately. And then I came to, I had no idea where I was. I got the rest of the day off from work. And then I got the report back and they said, no problems, but thanks for coming in. So at any rate, it was a huge load off my mind. Are you still on the front lines of the testing?
Yes and no. Yes, I am the nurse manager at VCU Health for the endoscopy department. So, yes, I have the leadership responsibilities of the entire endoscopy department. I have worked in procedure rooms for almost 30 years. I still am in and out of them. I don't assist quite as much as I used to, but I am still very much a part of the procedures that take place. The procedures are quite simple, as you would say. It's very simple from my perspective because I'm used to seeing them and it's routine for me. But I try to make sure my staff remember that this is not a routine test for other folks. They're coming in there. They're either scared, they have a family history, they're petrified of that, they're having symptoms. They might have had a previous testing, like a FIT test, that has come back positive, so they're really frightened. But we give really good drugs to make it all possible. Of course, there is that blessed bowel prep that has to be taken the day before. Most people dread that, but that is absolutely the most important part of the test. We need a clean colon. And then we can see those walls, see those polyps when they're very small, as Dr. Vorenberg stated, and remove those. Not every single polyp is a cancer, but every single cancer was once a polyp. And so we definitely want to remove those when those are small. And then, based on the results, the patient might come back in 3, 5, or 10 years. But that's all based on what we find, family history, and that sort of thing. The procedure actually only takes about 20 to 30 minutes. It's changed a lot in the years that I've been in practice. It used to be about an hour. Many years ago, the bowel preps weren't as easy to take, and now they have either flavors of the bowel preps or you can add some Crystal Light to the solution, and it's much more palatable. I've taken it myself. I can now speak to the test. I've had 2 colonoscopies with good results, and I think that helps a lot as well, to be able to speak to the patients and say, look, I've had this, and to just try to make them as comfortable and relaxed as possible.
That's a great point about every tumor was once a polyp. Got to start somewhere. Mm-hmm. Okay, let's talk a little bit about the work that Hitting Cancer Below the Belt is doing in the community as far as education. We've talked about early detection and probably most importantly, some support services. A little bit about some background about those various features of the organization.
Yeah, we started off with the main initiative as Eat Clean, Get Screened. And so we've been talking about early detection, the get screening piece of Hitting Cancer Below the Belt. And we fund FIT in-home colorectal cancer screening kit tests for the free clinics. The free clinics, there's 22 free clinics in the area, and right now we have 5 free clinics that work with us. So they have a colorectal cancer screening program for the folks that are uninsured and that are patients of their free clinic, and we fund these in-home tests, which has been quite successful over the last year and a half, 2 years. So we're excited about that and continuing that program and hoping to get more free clinics to join us so we can get more folks that are higher risk screened. And then we also partner with health departments to offer a flu fit clinic each year. So when community members come in to receive their flu shot, they're all pre-screened for their risk of colorectal cancer. And if they're eligible, they will receive a free FIT in-home screening tool on site that day to take home and complete the test and then mail back to the health department to be tested. So that's, in a nutshell, what we're doing in regards to early detection. Those are some extra services. The educational piece of Hitting Cancer Below the Belt is threaded in our services and our events. So there's not just an education department, if you will. It's threaded in everything that we do. So in regards to the Eat Clean services, we offer nutrition support in the form of a healing basket. It's called a Healing Belly Basket, and we give this free gift to cancer patients and survivors. They just request on our website that they are wanting a free healing basket, and we either ship it or we deliver it, because there is an educational piece, obviously, to go over the items in the basket. All the items are gut-friendly foods to help that microbiome heal and seal itself, especially after the treatment that they've probably had. The gut seems to be a little stressed, and GI issues are very common. So all the items in the basket really help with the inflammation and potentially needing to seal that gut lining so we don't have peptides moving into the bloodstream causing even more inflammation throughout the body. And then at the same time boosting the immune system. And all these items can be found at the grocery store. So it's just a matter of them thinking about nourishing themselves a little differently. We also offer nutrition workshops and stress reduction workshops. And in the near future, the latter half of this year, we will begin offering exercise, consultations, assessments, and classes for those folks that are challenged with maybe some lymphedema, maybe some muscular imbalances, some flexibility issues, that sort of thing that also come along with the disease and the treatment. So we're moving forward in regards to offering a wide array of services for the cancer community.
And support for survivors as well, right?
Absolutely. Yeah, absolutely. Well, survivorship is prevention. We're trying to prevent a reoccurrence. So we're kind of on both ends of the continuum, if you will. We're prevention, early detection, and then survivorship. And that's truly where our focus is.
One thing we haven't mentioned is that March is Colorectal Cancer Awareness Month. The timing of this couldn't be more appropriate.
Right.
And you have some events coming up in the near future into, looks like June. You got a couple in March, one in June, including Strikeout Cancer involving 5 area high schools.
Right.
What's that all about? And how do you approach high school age kids? Or is that who you're talking to at this event?
Absolutely. Mm-hmm. This is our 5th year we've been doing this, and I know this warms Kristi's heart because she's really wants to get the word out to the millennial population about this risk of colorectal cancer rising in this younger population considerably. So we're starting even younger, and so for 5 years we've had Strikeout Cancer. We bring local high schools together. We started off with just 2. We're up to 5 high schools. It's an hour and a half of crazy bowling fun at Bowl America off Hull Street, and we get, I believe, Jack and Melissa Chase are going to join us again this year and help kick it off. We'll have some great music, great prizes, but it's truly all about educating them in regards to GI issues and GI distress, risk of colorectal cancer, talking about colon health as well. And then, as I had mentioned earlier, the Can We Talk initiative is a one-pager where they can ask themselves these 6 questions, and then they're encouraged to take it home to their parents, who most likely are of screening age. So we start this conversation early, and it's kind of fun to watch their face, when we're talking about going to the, having a bowel movement every day. We talk to them about this, making sure that you're eliminating every day, making sure we know what actually is coming out. Is there blood in the stool? If so, talk to your parents, talk to your doctor. We are seeing more and more young people with this type of GI distress, as well as Crohn's disease and other types of GI issues that Dr. Vorenberg has already mentioned. So we're also taking the Can We Talk initiative onto the campuses. We're going to be at Virginia State University on Monday and kind of doing something very similar. We have a huge inflatable colon that people can walk through, and it's a great educational tool that's also quite entertaining. So that kind of goes with us everywhere that we go. Strikeout Cancer is in March, as well as many community events. We're partnering with VCU Health as well in March, and going to be down at Dominion Energy's Health Fair in April, and we're hitting the road. Yeah,
it sounds like it. Inflatable colon. That's unique.
It's 12 feet high,
That's awesome.
12 feet long, 10 feet wide. It takes up some space. You can't miss it.
Do you have to introduce some humor when you're addressing younger people like that?
Yeah, one of our slogans is "Love your gut, protect your butt."
All right,
and we have to be really careful because we don't want to offend anybody.
Yeah,
so of course
absolutely.
We don't take this into the elementary schools or middle schools, but high school students and college students they can handle that slogan. Or for the Boxer Brief 5K run we have in June, we'll say "Dress your bum and come out to run." Yeah, potty time is no longer private time, and I know Dr. Vorenberg's got. Well, he has it. He wears it proudly on his shirt and on his hat. He's got some really cool slogans that he uses as well. Yeah.
Yeah, well, we have a team. My operating room team comes out, and we have a special nickname for that team called Team Rectum. I'll give a shout out to the team.
All right, that's awesome. Okay, how about preventing colorectal cancer? Is there a certain type of diet? Are there certain items you should be introducing into your diet practices, i.e., say, use of laxatives, things of that nature? What can you do, Dr. and Kristi, to help prevent, especially if you have a family history?
Right, and I get this question a lot, and the answer is we don't really know. There's no good data out there because there's so many various types of people with family histories and no family histories. We think there's got to be something environmental and genetic component to it as well, that we can't nail down exactly what will help you prevent colon cancer from a diet perspective. So what I tell my patients is stay away from inflammatory things like smoking or high-fat diets. Do introduce a high-fiber diet to allow for your colon to continue to move those carcinogens, whatever they may be, through your GI tract at a more reliable pace. So a high-fiber diet, low-fat diet, and stay away from smoking.
I do want to add something, the importance of hydration. 90% of us are dehydrated. And so fiber is critically important. And then you get that from fruits and vegetables. And you got to be careful of the breads because some of the breads aren't clean. So obviously we want breads in our diet as well, but be really careful about eating too many grains, especially if there's a lot of GMOs, environmental toxins in the wheat as well. So we need to be careful about that. But you can eat a lot of fiber, but if you're not hydrated, it's going to be a brick in the GI system. It's not going anywhere. Mm-hmm. We need it to go somewhere. We need to move it through. And most of us are severely dehydrated, and we don't even realize that. And so clean water and hydration is critically important. In regards to the fats, we have to be careful about, the types of fat that we are eating, but there's good quality fats out there that we do need. So when we do choose those fats, we need to make sure that we are, obviously choosing the raw nuts and the avocados and the olive oils and the coconut oils, all those great fats that just help to seal that gut lining. So we do know. We can't state that prevents colon cancer, but we do know, as Dr. Vorenberg said, that helps to fight inflammation. And again, hydration is critical to, as he said as well, we have to move things through. And fiber is important as well.
Inflammation is coming up more and more these days, just general inflammation and what aggravates it and how much of a problem it is mm-hmm. to the body. It's not a word that you seem to hear that much until, say, the last 20 years or so, and supplements like turmeric and things like that to mm-hmm. combat inflammation seem to be more and more popular. Are they effective? Are supplements and preventative measures like that, are they effective in kind of staving off inflammation?
The jury's out.
We still don't know, do we?
The jury's out.
Yeah, I'm not sure about that.
Yeah, we don't offer supplements like in our Healing Belly Basket. We don't promote supplements. I take a lot of supplements. I don't promote that. The jury is definitely still out. But when you're needing good quality nutrients, and if you're not getting it in your food, you got to get it from somewhere. And so again, we always let folks talk to a nutritionist in regards to if they're thinking about supplements. But as far as herbs, garlic, lots of sulfur. Sulfur helps to pull metals and toxins out. Garlic and onions, foods that we love to eat and should be eating. The turmeric and the fresh herbs, the rosemary, the parsley, the cilantro, fantastic for you. Good pack full of antioxidants, easy to digest. But again, we can't say that's going to prevent colon cancer, but what we can say, it will help fight inflammation, which is the root cause of all disease, diabetes, even this gut-brain axis that we're knowing more and more about now. They're even looking at gut dysbiosis, if you will, affecting depression and anxiety. So it all mm-hmm. leads back to inflammation. So, yeah.
Before we start to wrap up, I noticed on your website, I wasn't aware that there are multiple screening options. I just kind of went with conventional wisdom. What are some of the other screening options, or what are the screening options, and are some of them better than others?
I would like to take a shot at that question.
Sure.
So yeah, there are lots of screening options out there, okay? All the screening options are looking for basically colon cancer, okay? The blood in your stool, probably from a cancer. A barium enema, okay, an X-ray test where they take you to the radiology department and they put contrast up your bottom, looking for large lesions. Can identify polyps, but it's diagnostic, but not therapeutic. So you can't do anything about it. You got to go have a colonoscopy if there's a positive test there. CT scans, they have CT colonography, also diagnostic but not therapeutic. Can find some larger polyps. But the vast majority, all the tests out there on the market are diagnostic. The only one that is therapeutic is colonoscopy. The only one that you can actually do something about at the time that you identify the polyp is colonoscopy. So that is by far and away the best test to prevent colon cancer.
Why would someone do anything other than colonoscopy?
Because if you're not going to do a colonoscopy for whatever reason you choose to not do a colonoscopy, it's better to do something than nothing. I would urge people, just go get a colonoscopy. It's going to be the best test that's going to have the best chance of saving your life from colon cancer. So go get that colonoscopy. And if there are lots of reasons why you just don't want to do it, then fine, do one of these other tests. But do something to identify a problem. But colonoscopy, far and away the best.
It's interesting when you give folks options, if they are not going to bite on a colonoscopy and you give them other options such as maybe a FIT screening tool or the new color guard that's out or whatnot, and it comes back positive, if they say, okay, I'll do that test, the in-home test, and it comes back positive, I believe it's like as high as 70 or 75%, then go immediately and go get the colonoscopy. So that's why Dr. Vorenberg saying just do something, because if it comes back positive, they're going to go back and see Dr. Vorenberg for their colonoscopy. Most people don't, when they have a positive in-home screening test, don't sit on their hands. They want to know what's going on. Yeah.
And if I can add, I started noticing the younger population getting diagnosed with colon cancer just in my own practice. So I decided to do some research on that because I started seeing the trend. I actually presented colon cancer, Beware Millennials, Colon Cancer is on the Rise at our national SGNA conference. And the article was actually published as well. And I have children that are millennials. Any of our young adults that were born in the 1990s have twice the risk of colon cancer than even our age in our 50s. They have 4 times the risk of rectal cancer. So after I gave this presentation to nurses, they wanted the magic bullet. Okay, what do we do? How do we prevent it? And it was the same type of thing that Mindy touched on and Dr. Vorenberg touched on. We really don't know, but we do know that the environmental factors are definitely making this increase. So it goes back to the basics of good nutrition, exercise, sleep, reduce the stress levels as much as you possibly can. But the most important message to our millennials that I would have to say, and what I told the nurses, you need to listen to your body. And if something doesn't feel right, if it's different, you need to go get it checked out. It was a very common practice that when young women had bleeding, they were kind of written off that it was hemorrhoids, especially if you're of childbearing age. That was just the old adage, oh, it's just hemorrhoids. You've got to push further and further and advocate for your own health and for those that you love to have testing done no matter what your age is.
I'm glad you brought that up. Conventional thinking has made this a men's issue. Why is that? Do we know why that is? And is that true?
Not at all.
Not at all.
Not at all. It's what I said a couple of weeks ago is that everybody has a colon and a rectum, and nobody is immune from this problem. It does not seem to be a male or female problem. So everybody's at risk. If anybody has bleeding, and Kristi, I appreciate your point about rectal bleeding is not always hemorrhoids. And in the male or the female population, advocate for yourself and do something about it because it's not always just hemorrhoids. Just have a conversation about it and talk to somebody about it so that you're not a statistic. Having a colonoscopy is much easier than going through surgery, chemotherapy, radiation, and potentially dying. So advocate for yourself. Talk about it.
And just to make it real clear, your colon is your large intestine. Some folks aren't quite sure what a
great
colon
point, yeah.
is. And so we like to say colorectal cancer. And I got some feedback from a friend of mine that said, Mindy, I don't even know what that is. Colorectal. We're talking about colon and rectal cancer. We've just kind of squished it into one word, if you will. But it's your large intestine and then your rectum. And then also, your anus. That anal cancer is something different, but still, it's all in that area. So it's the last area where the stool is reabsorbing water and passing through. And as Dr. Vorenberg stated, we all have a colon, meaning we all have a large intestine. And that was something that when my husband was diagnosed, I had to look that up. And I was at the time 40 years old, and I was like, what exactly is your colon? I did not know that. So I think as an organization, we have to be really clear about what we're talking about. And it's 50-50 basically, 50% women, 50% men that are diagnosed. It's right down the, right down the lane. I don't know how it started to be thought of as an old man's disease. I don't know when that started. Yeah.
Do you share that perception? Is it just me? Because for some reason in the zeitgeist, the cultural zeitgeist, it just feels like it's been a men get screened, but
we get it all the time.
Yeah, okay.
Oh, I get it all the time by professional people. Women can get colon cancer too, or I'm too young. Mm-hmm. All the time. I'm sure you all do as well. Yeah, I'm just more out on the street. I'm not in the medical community, but I'm sure you all do as well. Yeah.
Fascinating. Thank you all so much for being here. Mindy, why don't you run down the contact info and maybe hit those dates one more time? Yeah,
well, we have Strikeout Cancer March 5th at Bowl America on Hull Street. If you want a loud, obnoxious, fun, very energetic hour and a half of time, come on by, 4:30 p.m. on March 5th. That's a Tuesday. We have the Boxer Brief 5K. This is our 7th year offering the Boxer Brief 5K. And that is Saturday, June 8th. It's back at Stony Point Fashion Park. We have a DJ, and we do have a band on the course this year.
Who's the band?
The band is What's on Tap, John Galloway.
All right.
John Galloway, What's on Tap, and he actually is a colon cancer survivor, and he's fantastic. His band's fantastic, and
awesome.
So he's going to be there, him and his band. That starts at 8 a.m., and we do have a free activity for the children called the Caped Colon Crusader Run, and it's free for children under the age of 8. It's about a half-mile sprint, and we encourage all the kids to wear their favorite capes as they run that event. And so our contact information is HCB2.org. That's an acronym for Hitting Cancer Below the Belt. All the information can be found on the website, but you can find us on Facebook at Hitting Cancer Below the Belt, and you can find us on Twitter at Hit Below the Belt.
Before we close out, is there anything that I did not hit that you want to mention? Anything important or anything?
Yeah, I wanted to mention our free screening program that we do for folks that don't have access to care. So about 3-4 years ago, we started a program in collaboration with Access Now, which is a branch of the Richmond Academy of Medicine that helps deliver care for patients who don't have insurance. People who make too much money to get Medicare or Medicaid and not enough money to actually purchase insurance. There's a whole boatload of those folks floating around town.
Kind of a dead zone.
And they need colonoscopies, screening colonoscopies. So they end up in like free clinics around town, and there's a backlog of folks that need screening colonoscopies. So we started a program as part of our mission to offer free colonoscopies for these people, and we've done it in collaboration with Midarva. We've done it in collaboration with Bon Secours, and a lot of volunteers have come from both institutions and HCB2 and Access Now to help us do over 60 colonoscopies for free in Richmond. And 50% of those folks had polyps that were identified and removed at the time of the screening.
Wow.
Which are folks that would never have gotten colonoscopies, most likely.
So how does that work? Do the volunteers go on site to the various facilities, Bon Secours hospitals or something, directly on to the hospital?
No, actually, HCB2 partners with Access Now. Access Now, as Dr. Vorenberg discussed, is a charitable arm of Richmond Academy of Medicine. So they oversee all the secondary care that these patients that attend the free clinics, what they need, such as mammograms, that sort of thing. So there's a wait list for folks that are needing colonoscopy. screening colonoscopy. And so Dr. Vorenberg said, well, we can knock that out in one day. And I was like, well, then let's do it. So we work with Access Now to reach out to those patients, get them scheduled. And then Hitting Cancer Below the Belt will offer them free bowel prep. We offer them free bowel prep food, such as coconut water and Crystal Light and yellow Jello and all that kind of good stuff. And then we help provide money for their transportation because a lot of these folks need to take time off from work, or they need to find someone that takes time off from work, or they don't have gas money. So we provide the money for the transportation, set up the schedule in conjunction with Access Now. And then, as Dr. Vorenberg stated, it's such a beautiful collaboration of, to be honest with you, usually competing GI groups.
Right.
Do you see what I'm saying?
Yeah.
And you've got doctors and nurses all coming together for that one day. You had GSI docs, RGA docs, CRS docs, Bon Secours nurses, surgery center personnel from Madarva or from Bon Secours, depending on the venue of that for that year. And it's just about a 6-hour day of goodwill, and you just feel so amazing afterwards because we're saving lives, directly saving lives.
And that's really what is powerful about what we do. And for me, being from Richmond, it is really important for me to help make this community healthier. And one of the things that Mindy and I talked about and Kristi, when we started talking about doing this free colonoscopy day is, what if we can make Richmond a healthier place and drive down the rate of colon cancer in Richmond, because we're taking care of our neighbors that don't have access. We're taking care of our community with the information. What if we can drive the rate of colon cancer down in Richmond and show the world that it's possible with conversation and with helping each other out? That is powerful. That is saving lives.
That's
and
incredibly
that's what
powerful.
This is about.
I'm sorry, go
And
ahead.
I was just going to say, I'll leave you with our vision, and our vision has grown organically, over, expertise like Kristi Seay and Dr. Vorenberg and the other board members' expertise and people that cross our paths, such as you, Jay, and whatnot. So our vision has really morphed into HCB2 is building and bridging resources to create a community where cancer is challenged to survive. And we use that a lot on everything that we, promote. It's really creating, as Dr. Vorenberg said, a community where we're challenging cancer to even survive based on the services, the education, the events, and then obviously the free colonoscopies for folks who are at such a high risk and they cannot afford this procedure.
Well, just having a conversation, which is how we ended up hooking up, is so important. And having a conversation with your doctor and talking about uncomfortable subjects keeps it all moving forward. It's just amazing that you guys have been able to do this. Have you been able to see any numbers proving exactly what you're trying to accomplish, making Richmond a healthier city? As far as you mentioned, the 50 people that actually were helped by the program. Have there been any other statistics that have come out that have kind of brought that to light?
Yeah, our partnership with Health Brigade's going on its third year right now. We offer the free fit kits for Health Brigade. That's one of the clinics that we work with. And Dr. Mindy Conklin over there is just so complimentary of us funding these fit kits. She has a 75% return rate of these fit kits, which is unheard of. It's usually around 30 or 40%. And so she has basically said, you are saving lives, because if these fit kits come back positive, they immediately these patients get a colonoscopy. It's diagnostic colonoscopy because they know something's going on. They've got to take a look at it. So they're not on a wait list. So we're driving more people to get a colonoscopy just by offering these in-home screening kits. So as of right now, we're new into this. We've only been doing these services for about 3 or 4 years. We do understand that our partners, we're putting more work on their plate, basically creating new colorectal cancer screening programs within an already extremely busy organization. So we understand that there's some wrinkles and there's been some missteps, but there's also progress. So we're happy about that.
That's great.
Yeah.
Mindy Conklin, Dr. Vorenberg, Kristi Seay, thank you so much for being here. It's been enlightening and informative. I appreciate it, and you're doing great work. Thank you very much.
Thank you for having us.
Thank you.
Thanks again to my guests for joining me on this episode of the Well and Good podcast. Mindy Conklin, founder and executive director of HCB2, Dr. Andrew Vorenberg, Colorectal Surgeon with Colon and Rectal Specialists and board member of HCB2, and Kristi Seay, Endoscopy Nurse Manager with VCU Health and current Chair of HCB2. And thanks to my guests for suffering through my cold. Had a bit of a cold when we recorded that. All better now for the time being. Hopefully nothing's going around. And thanks to you for listening. Hit me up. All the information is at the Well and Good Podcast website, wellandgoodpodcast.com. All the social media presences, all the contact info, past episodes. You can subscribe via Spotify and iTunes there. Feel free. Use that if you have any suggestions for future episodes, any questions, all that. So thanks very much for listening. Until next time, be well.